Welcome to the Pet Stop. I'm Dr. Brian Voynick. Well, we're continuing our discussion today on the use of stem cells in veterinary medicine. So for pet owners who are skeptical, there's actual proof that this therapy really works. Joining us again is this week's veterinarian, Dr. Mike Hutchinson. Great to have you on again.
Pleasure is mine. Thank you.
Okay, so we've both been using stem cells for a long time, but we were using fat-derived stem cells, and it's worked well. But tell us about the new advancement.
So what's nice about this, to get the fat, we had to put the animal under anesthesia.
Sure.
So you get these older dogs, 12, 13, 14, 15. Not all of us are real happy about that, but that was the technology available and it worked.
Right.
Now we can take a blood sample.
Unbelievable.
I mean, how neat is that?
I love it.
Take a little bit of blood, and then we harvest out an actually more powerful stem cell.
Yeah.
And it can do more things. And
yeah, if anyone wants to look at it, they're called Muse cells, M-U-S-E. And look at this horrible set of hips. We should have a normal ball and socket joint. And this poor dog, Molly, was going to be euthanized because she couldn't stand from a lying position, and she was put on dexamethasone steroids. So when the owner said, "Can stem cells help my dog?" I said, maybe, but I was really skeptical. And she said, "Look, isn't it a better alternative than euthanasia?" And here she is after stem cell therapy. Not only could she stand, but she's actually able to walk around, and this is just 30 days after the hips were injected with stem cells. And this, as Dr. Mike mentioned, this is with fat, adipose derived. Nowadays, an older dog like this, we don't have to anesthetize them at all, just to draw a blood sample.
And we can get out a more powerful cell.
Yeah.
Maybe it'll do even more good, and that's what's exciting.
And the cool thing is nanotechnology. Tell us about it.
So nanotechnology, sometimes when you put them into a joint, these cells, they go out, they look for inflammation. If we want to hold them in that microenvironment, that joint, we can combine them with a nanoscaffold that's microscopic, of course.
Okay, so that's 1/200th of the diameter of our hair.
That's one nanoscaffold fiber, 1/200th width of a human hair.
Right.
We mix them together, and they just start to adhere and proliferate, and it keeps them in place.
Yeah.
And then the nanoscaffold breaks down into lactic acid and goes away within 60 days.
Thanks, Dr. Mike. Great to have you on the show.
Pleasure's all mine. I hope people find out about this.
All right. Well, here's what we're working on for tomorrow. And remember, you can always catch the Pet Stop every Saturday and Sunday during our morning and afternoon newscasts. Well, you've got pet questions. I've got some answers. Here's what I'm answering this week. How do I stop my dog from chewing up the furniture? Wow. Well, that has to stop. That has to start when your pet is 6 or 8 weeks old when you first get the pet. You need to go to an obedience class, but that's being proactive. I always recommend that. However, when you have a problem in an adult dog, you have to see your animal trainer, behaviorist. Talk to your veterinarian about the best behaviorist in your area. And for more information on anything about today's show or past shows, log on to our website. That's news12.com. Click on features and then scroll down to the Pet Stop. You'll find all the information that you need right there.